This is All India Radio. Good afternoon. I'm Tanvi Taneja, and with me is Prashant Kumar Sinha with the Midday News. The headlines. Maharashtra, Telangana and West Bengal announced extension of lockdown till 30th of April. Agriculture Minister Narendra Singh Tomar assures there will be no shortage of food grains in the country. Srinagar-Leh highway reopens to maintain the supply of essential commodities. Consignment of hydroxychloroquine from India arrives in the United States. And Easter celebrations across the world amid COVID-19 pandemic. President, Vice President and Prime Minister greet people on the occasion. Maharashtra, Telangana and West Bengal have decided to extend the lockdown till 30th of April. Maharashtra Chief Minister Uddhav Thackeray has said that the lockdown will be extended in the state till 30th of April. He said he had expressed the willingness to extend the lockdown during video conferencing with Prime Minister Narendra Modi yesterday. Mr. Thackeray warned against complacency in the fight against the virus outbreak. In order to control COVID-19 cases, the Maharashtra government has divided the three divisions, which is red, orange and green. More from our Mumbai correspondent.
Due to increasing number of COVID-19 patients, Maharashtra government has divided the coronavirus infected districts into three divisions to deal with the disease. The categorization has been done in red, orange and green districts. Districts which come under the red zone are Mumbai, Thane, Pune, Nagpur, Aurangabad, Raigad, Palghar and Sangli. Orange zone includes Ratnagiri, Sindhudurg, Satara, Kolhapur, Nashik, Ahmednagar, Jalgaon, Osmanabad, Beed, Jalna, Hingoli, Latur, Amravati, Akola, Yavatmal, Buldhana, Wasim and Gondia. Districts that come under green zone are considered to be the safest with no COVID-19 cases, and they are Dhule, Nandurbar, Solapur, Wardha, Parbhani, Nanded, Chandrapur and Gadchiroli. Districts with more than 15 coronavirus interrupted patients have been placed in red zone. Districts with number less than 15 have been placed in orange zone. In addition to the stringent security plan, there is a possibility of further enhancement of the ban while maintaining lockdown in red zone district. Meanwhile, 134 more cases have been found from Raigad, Amravati, Mira Bhayandar, Navi Mumbai, Vasai Virar, Pimpri Chinchwad and Pune. With this, total number of cases have surged to 1,895 in the state. With Kunal Shinde, Pooja Pal, AIR News, Mumbai.
West Bengal government also announced extension of ongoing lockdown till 30th of this month. The state government has also announced suspension of classes in schools, colleges and universities till 10th of June. 6 fresh corona positive cases have been detected in the state during the last 24 hours, taking the total number of patients to 95. Telangana government also extended the lockdown till 30th of April. The state cabinet cleared a proposal to this effect yesterday. Chief Minister K. Chandrasekhar Rao said the state border with Maharashtra will be completely sealed. The state government has stepped up measures to contain the spread of coronavirus. The number of containment zones in the state have increased to 243, including 123 in Hyderabad and Sikandrabad. With 16 more people testing positive for coronavirus, the total number of COVID-19 cases in Telangana has risen to 503. 2 more people succumbed to COVID-19 yesterday. With this, total deaths reported due to COVID-19 has gone up to 14. 51 people recovered from the disease and discharged from hospitals. With this, total recoveries reported in the state have also gone up to 96. Over 25,000 people who were under quarantine have also been released. In Madhya Pradesh, in the last 24 hours, 49 new patients have been found in Indore, while 7 people have died. The total number of patients in Indore has increased to 298, while the number of corona infected has reached 546 in the state. The government is making every effort to prevent corona outbreak in the most infected city of the state, that is Indore. 102 doctors and several senior officials from across the state have been sent to Indore.
A 4-tier plan has been implemented for better treatment of people suffering from corona infection in Madhya Pradesh. Bhopal and Indore have been divided into several separate zones. State-level crisis management groups have also been set up at district level to free the state from corona. Corona-affected hotspots have been identified and converted into containment areas. Telemedicine centers have been set up in all the districts to directly communicate with the people quarantined at home. Proper arrangements have been made for testing of COVID-19 in the state. Government medical colleges in Indore, Bhopal, Jabalpur, Gwalior, Rewa and Sagar, as well as 8 private medical colleges and 107 hospitals of the private sector have been identified for the treatment of patients. In particular, 23 hospitals have been identified for the specific treatment of COVID-19. 1,000 tests are being conducted daily in the state. Sanjeev Sharma, AIR News, Bhopal.
The trend of Kerala's COVID-19 infection curve remaining flat continues, as state reported only 10 new cases lately. Presently, 228 patients are under treatment in Kerala. 143 people have recovered so far. Over 1,24,000 people are under observation in the state. Meanwhile, Kerala celebrated the Easter amid COVID-19 lockdown. A report.
As Christians across the globe celebrate Easter today, churches in Kerala commemorated the occasion without the presence of any devotees. Easter services were conducted by not more than 5 people, including the priest and his assistants. Empty churches, virtual prayers, live streaming of Holy Mass, Facebook Live, YouTube speeches of bishops and priests marked the Holy Week and Easter Sunday in Kerala this time, cutting across villages and cities. Even as people celebrated Easter at their home following the lockdown guidelines, the prayers at home and churches were filled with the spirit of hope and unity to overcome this difficult time. Mayusha for AIR News from Thiruvananthapuram.
Agriculture and Rural Development Minister Narendra Singh Tomar assured that there will be no shortage of food grains in the country. In an exclusive interview to DD News, Mr. Tomar said that there is sufficient stock of food grains and the government is committed to protect the interests of farmers during the ongoing harvesting season. He highlighted the timely steps taken by the government to minimize the impact of lockdown on farmers and laborers.
बात करेंगे केंद्रीय कृषि और ग्रामीण विकास मंत्री नरेंद्र सिंह तोमर जी से। नरेंद्र सिंह जी, सबसे पहली जो चिंता इस समय ग्रामीण लोगों में है, किसानों में है कि अभी कटाई का वक्त चल रहा है। यहाँ से क्या संदेश दिए गए हैं कि लॉकडाउन का उस पर असर न पड़े और कटाई जो है निर्बाध रूप से होती रहे?
जहाँ तक कृषि और फसल कटाई का सवाल है, हम सब जानते हैं कि भारत कृषि प्रधान देश है और इसलिए कृषि को किसी प्रकार का नुकसान लॉकडाउन में न हो, यह सरकार की प्राथमिकता है और इसलिए फसल कटाई के लिए किसान को, खेतिहर मजदूर को और उसमें लगने वाली जो मशीनें हैं उन सब की आवाजाही को अनुमति दी गई है, जिससे फसल कटाई प्रभावित न हो।
अनुमानतः क्या आंकड़ा होगा उत्पादन का?
अभी एकदम आंकड़ा कहना तो मुझे लगता है जल्दबाजी होगी, लेकिन सामान्य तौर पर जैसे नुकसान की संभावनाएं बताई जा रही है वैसी संभावना नहीं होगी। हम पर्याप्त मात्रा में अपने लक्ष्य के नजदीक पहुंच पाएंगे।
गेहूं की कटाई के बाद जो मार्केट में आएगा उसके लिए किसानों के लिए कोई प्लान है, कोई योजना है?
हम लोगों ने ये कहा है कि राज्य जिस तारीख को भी घोषित करे अपनी सुविधा के अनुसार, उस तारीख को वो खरीद शुरू कर सकता है और उस तारीख से 90 दिन तक खरीद की अवधि होगी, इसलिए इसमें कोई तकलीफ उनको आने वाली नहीं है। लॉकडाउन के कारण अलग स्थिति है, कोरोना वायरस के कारण अलग स्थिति है, तो वो जिस प्रकार का भी मैकेनिज्म तय करेंगे और जो स्थान अधिसूचित करेंगे, हम उसी स्थान पर खरीद को प्रारंभ कर देंगे। हमने यह भी कहा है कि आगामी 3 महीने के लिए राज्य सरकारों को मंडी एक्ट से खरीद को छूट देनी चाहिए। किसी भी स्थान पर किसान और व्यापारी मिलकर खरीद का यह क्रय विक्रय कर सकते हैं, यह अनुमति राज्यों को देनी चाहिए।
खाद्य सुरक्षा के लिहाज से भारत कितना तैयार है और कितना मजबूत है इस वक्त?
भारत पूरी तरह खाद्यान्न व्यवस्था की दृष्टि से चाक चौबंद है और आने वाली फसल भी आने वाली है, इसलिए खाद्यान्न का कोई संकट भारत में न है, न आने वाले कल में होगा।
क्या नरेगा के बारे में भी कोई प्लान बन रहा है?
ग्रामीण क्षेत्र में लोगों के पास पैसा हो, इस पर केंद्र सरकार ने पर्याप्त बल दिया है। हम लोगों ने इसी सप्ताह में पीएम किसान सम्मान निधि के अंतर्गत 2000 रुपए प्रति किसान जो हम देते हैं, उसमें 7 करोड़ किसानों को ये पैसा पहुंच गया है। साथ ही प्रधानमंत्री फसल बीमा योजना का जिन किसानों का पैसा लंबित था, उसमें 1500 करोड़ रुपया ये डिस्बर्स लॉकडाउन की अवधि के दौरान ही हम लोगों ने किया है और मनरेगा का 33,000 करोड़ रुपए की स्वीकृति हमने राज्यों को दे दी है। व्यक्तिमूलक काम मनरेगा के अंतर्गत चल रहे हैं।
Vice President M. Venkaiah Naidu has appreciated the spirit of farmers for braving all odds in the wake of COVID-19 pandemic and sowing summer paddy crop in 37% more area than last year. Mr. Naidu expressed happiness that overall sowing of various crops, including rice, pulses, coarse cereals and oilseeds, is 31% higher than usual. He hoped that apart from ensuring supply of fertilizers and pesticides to farmers, the states will take adequate steps to ensure availability of farm machinery on time. The Vice President hoped that states will create better marketing conditions for farmers, as suggested by Prime Minister Narendra Modi, by relaxing provisions of the APMC Act to allow direct marketing by farmers and to prevent crowding of mandis. A total of 7,529 confirmed cases of novel coronavirus or COVID-19 have been reported in the country so far. Out of these, 652 patients have recovered and been discharged from hospitals, while 242 patients have died. Briefing media in New Delhi yesterday, Joint Secretary, Ministry of Health and Family Welfare, Mr. Love Agarwal said, India's response to contain the COVID-19 has been proactive and it has followed a graded approach. He said in coordination with the states, the centre is ensuring supply of PPE, N95 masks, testing kits and ventilators, and dedicated COVID hospitals are also being set up to provide proper treatment. Mr. Agarwal informed that as of now, 586 dedicated COVID-19 hospitals have been set up with a capacity of more than 1 lakh isolation beds and around 11,500 ICU beds.
डेडिकेटेड कोविड हॉस्पिटल्स जिनके द्वारा इन्फेक्शन ना फैले और पेशेंट्स को प्रॉपर ट्रीटमेंट मिल सके, उसको भी स्टेट के साथ मिलकर, सेंट्रल गवर्नमेंट इंस्टीट्यूशंस के साथ मिलकर बनाया जा रहा है। और अब तक की अगर संख्या देखें तो 586 डेडिकेटेड हॉस्पिटल स्टेट ने हमें रिपोर्ट किए हैं, गवर्नमेंट ऑफ इंडिया और स्टेट गवर्नमेंट ने मिलाकर, जिसके द्वारा करीब 1 लाख प्लस बेड्स, आइसोलेशन बेड्स और करीब 11,500 जो उसमें आईसीयू बेड्स भी उन्होंने प्रिपेयर किए हैं।
Mr. Agarwal said the Ministry of Ayush has prepared a set of guidelines on respiratory health and ways to boost immunity.
इसके साथ ही आयुष मंत्रालय ने इम्यूनिटी बूस्टिंग और रेस्पिरेटरी हेल्थ के लिए जो अपनी एक गाइडलाइन जारी की थी, उसके द्वारा उन्होंने फिर कहा है जिले के जितने डीएम्स हैं कि आप जब डिस्ट्रिक्ट का कंटीजेंसी प्लान बनाएं तो उसमें उन गाइडलाइंस को भी शामिल किया जाए। स्टेट्स के साथ कोऑर्डिनेट करते हुए गवर्नमेंट ऑफ इंडिया का मेजर एफर्ट है कि कंटेनमेंट पॉलिसी, कंटेनमेंट एक्शन प्लान, कॉन्टैक्ट ट्रेसिंग और क्लिनिकल मैनेजमेंट पेशेंट्स का ढंग से किया जाए। और इसी के तहत ही इससे पहले भी एम्स में एक ट्रेनिंग ऑर्गेनाइज की जा चुकी है। एक और सीरीज ऑफ वेबिनार्स जो नर्सेज की ट्रेनिंग के लिए इस वीक हम ऑर्गेनाइज कर रहे हैं।
As per the analysis done on the rate of growth of cases, Mr. Agarwal said that the lockdown and containment measures are important to fight COVID-19. If we had not taken any measures, then we might have had 2 lakh cases at this time. The central government has ensured availability of all essential commodities, including daily requirements, during the 21-day nationwide lockdown. Cooperation of citizens during the past 19 days of this lockdown has been exemplary and no incident of shortage of food supplies has been reported across sections of media. A detailed report from our correspondent.
Even though the centre announced a 21-day lockdown to curb the corona outbreak, it also ensured that the essential needs of the people do not remain under locks. While on one hand the private sector announced work from home or leave for its employees, the healthcare professionals, security forces, sanitation workers, railway employees, civil aviation employees, farmers involved in production of everyday needs, shopkeepers and even the delivery boys, through their untiring efforts, ensured that India wins in a nationwide campaign against corona. Every ministry, under the direct guidance of Prime Minister Narendra Modi, are constantly making efforts to ensure that there is no dearth of resources and food supplies across the length and breadth of the country. Prime Minister had 3 marathon meetings with state chief ministers and took stock of the ground situation of the migrant labourers, farmers, old citizens and women living in the hinterland of the country, and transfer of assistance amount to 30 crore beneficiaries under the direct benefit transfer scheme was also ensured. To maintain the supplies of daily essentials like milk, vegetables and cereals, railways alone transported more than 7 lakh vegan freight, which ensured that there was no shortage of goods in the market, and this is the reason that even on the 19th day of the lockdown, not even a single incidence of shortage of supply of food items from any corner of the country has surfaced. Home Ministry's far-sighted and timely decisions which restricted any hold loading and black marketing of goods ensured that though our common movements may be logged under this lockdown, but our requirements don't remain under locks. Anand Chaturvedi, AIR News, Delhi.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Maharashtra, Telangana and West Bengal announce extension of lockdown till the 30th of April. Agriculture Minister Narendra Singh Tomar assures there will be no shortage of food grains in the country. Srinagar-Leh highway reopens to maintain the supply of essential commodities. Consignment of hydroxychloroquine from India arrives in US. Easter celebrations across the world amid COVID-19 pandemic. President, Vice President and Prime Minister greet people on Easter. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Border Roads Organisation BRO opened the strategic Srinagar-Leh highway that connects Ladakh with the rest of the world. Yesterday, about 18 oil tankers and other essential commodities were initially allowed to move towards Leh Ladakh from the Zojila Pass. This was managed despite fresh snowfall in the Zojila Pass. The 425-kilometre road was closed since December last year due to heavy snowfall at Zojila Pass. As per the directions from Divisional Commissioner Ladakh, there was an emergent need for stockpiling essential commodities in the Union Territory of Ladakh. Keeping that in mind, the team of Project Beacon and Project Vijaya cleared the fresh snow around Zojila at the height of 11,500 feet and made the road motorable. Snowfall of this year has broken records of the last 6 decades. In Jammu and Kashmir, various departments in the Union Territory administration contribute significantly and reach out to the people tirelessly to mitigate their sufferings in the wake of COVID-19. Director, Rural Development Kashmir has said that 1 mask shall be provided free of cost to each member of households with Antodaya Anna Yojana, AAY ration card, pension beneficiaries, old age homes and orphanages. He further said that nearly 2 lakh masks have been procured by the department and about 1 lakh masks have been distributed among the people living in rural areas so far. More from our Srinagar correspondent.
Director Rural Development Department Kashmir Qazi Sarwar has informed that the department is presently producing 1100 masks per day which are distributed among the rural population. He said the department is utilizing the services of NGOs, local tailor shops, boutiques, KVIB, Women Development Corporation, community participation including the Panchayati Raj institutions. Meanwhile, in view of the surge in the number of positive cases in the Kashmir Valley since the last 2-3 days, the authorities have sealed off many areas and erected barriers at several places to strictly enforce a lockdown in an effort to prevent the spread of coronavirus pandemic. This is Sunil Kohl for AIR News from Srinagar.
Uttar Pradesh government has sent 17 foreign nationals behind bars after being found guilty of violating passport and visa rules. These include 10 nationals of Indonesia and 7 of Thailand. Bahraich police had arrested 21 persons, including these 17 foreigners, on 31st of March, and they were in quarantine. As soon as the quarantine was over, all 21 persons who were related to the Tablighi Jamaat were produced before the magistrate, out of which 17 foreign depositors were sent to jail on charges of violation of visa and passport rules. DG Prisons Anand Kumar told AIR that all these foreign nationals were quarantined earlier due to the risk of coronavirus infection, where their corona test report has come negative, and still in jail they are kept under quarantine barracks, and after 14 days they will be shifted to the normal barrack.
As of now, we have lodged them in a separate enclosure and quarantined them for a further period of 14 days as per the provisions of the jail manual. They are being monitored, and only after being certified fit enough to enter the barracks will they be allowed inside the barracks. As of now, I am informed by the district magistrate that they have tested corona negative. However, we are taking abundant precaution in this regard, and we have kept them in a separate enclosure in Bahraich jail.
In Bihar, 19 patients of coronavirus positive patients have so far been cured. Recovery rate of patient in the state is 30%. That is more than the national average, which is 10%. 64 positive cases of coronavirus have been reported from 11 districts. 44 active patients are undergoing treatment in special COVID hospitals throughout the state. 15 teams of NDRF have been deployed in 7 sensitive districts, including Siwan, Begusarai and Nevada, to sanitize coronavirus affected areas. The state government has constituted rapid response team in 9 medical colleges to detect positive cases of coronavirus in different parts of the state. Besides, over 86,000 ASHA and other health workers have also been asked of screening influenza-like illness patients. Meanwhile, Chief Minister Nitish Kumar instructed the DMs to personally monitor the harvesting operation and ensure that the farmers and farm labourers harvest their crops without hassles. Assam Chief Minister Sarbanand Sonowal is holding a meeting with the leaders of all political parties in Guwahati. Senior leaders of various parties are present in the meeting. Talking to AIR, State BJP President Ranjit Kumar Das said that all political parties have favoured to extend the lockdown period. In Arunachal Pradesh, in the fight against COVID-19, West Siang District Administration has launched Masks for West Siang campaign to provide masks for the people of the district. We have a report.
West Siang Deputy Commissioner Swetika Sachan has informed that the Mask for West Siang campaign initiated by Arunachal Doctors Association West Siang Unit is an effort to break the chain of the coronavirus infection.
This initiative is based on certain conclusion that wearing any kind of a mask, even a homemade mask is better than not wearing a mask at all, to ensure spread of this COVID-19 is broken, the chain is broken. And hence, this is kind of a public campaign in West Siang district whereby the APDA has taken responsibility wherein they will be engaging certain self-groups, women groups to make homemade cotton masks. And then they'll be undertaking to distribute at least 1 mask each person.
The Sachan also informed that very soon the district administration will issue an advisory on making the use of masks compulsory in the district. Rakesh Dole, AIR News, Itanagar.
The Labour Department is preparing a database of migrant workers stranded in the Andaman and Nicobar Islands. To reach and help out these migrant workers, all the members of the Panchayat Samitis and Zilla Parishads are requested to send their details like name, address, place, nearby police station and Panchayat's name over WhatsApp till next evening. The respective state governments of these migrant workers are ready to provide them with the financial support in view of COVID-19 outbreak, and for this purpose the database is essentially required. A report.
The Labour Department is preparing a database of migrant workers stranded in Andaman and Nicobar Islands. To reach and help out these migrant workers, all the members of Panchayat Samitis and Jilla Parishads are requested to send their details like name, address, place, nearby police station and Panchayat's name over WhatsApp till tomorrow evening. The respective state governments of these migrant workers are ready to provide them financial support in view of COVID-19 outbreak, and for this purpose the database is essentially required. Gaurav Patwal, AIR News, Port Blair.
A consignment of hydroxychloroquine from India has arrived in the US days after New Delhi lifted a ban on export of the anti-malarial drug to some countries on humanitarian grounds. Earlier this week, India, at the request of President Donald Trump, cleared the export of 35.82 lakh tablets of hydroxychloroquine to the US, along with 9 metric tons of active pharmaceutical ingredient required in the manufacturing of the drug. Trump, during a phone call last week, asked Prime Minister Narendra Modi to lift the hold on the American order of the anti-malarial drug, of which India is the major producer. India manufactures 70% of the world's supply of hydroxychloroquine. The United States has overtaken Italy as the country with the highest number of deaths due to COVID-19 pandemic, with the fatalities crossing 20,000. According to Johns Hopkins University, the US registered 20,597 deaths till yesterday, surpassing Italy's 19,468. In our series Expert Speak, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, head of pulmonary medicine, AIIMS, has advised the people not to take medicines like hydroxychloroquine or anti-malarial without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other anti-malarials without a proper prescription by a doctor. Do not self-medicate.
Another expert, Dr. A.K. Varshne, professor and consultant in medicine at the Atal Bihari Vajpayee Institute of Medical Science and Dr. Ram Manohar Lohia Hospital, New Delhi, said that hydroxychloroquine tablet is required for only frontline health care workers.
जांचें भी बढ़ाई जा रही हैं। जो संभावित पेशेंट हैं, जो कोई भी पेशेंट अगर ट्रैवल हिस्ट्री है पीछे, उसको अगर कोई रेस्पिरेटरी इन्फेक्शन, खांसी बुखार हो रहा है या उसके कांटेक्ट में कोई लोग आ रहे हैं वो है, या किसी भी व्यक्ति को अगर इस समय खांसी बुखार और सांस की परेशानी है तो सबकी जांचें की जा रही हैं। इसके अलावा कम्युनिटी में भी एट रैंडम टेस्ट भी किए जा रहे हैं, ये देखने के लिए कि बीमारी कितनी फैल चुकी है या कितनी फैलने की संभावना है।
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Madhur Yadav, Director and Professor in Medicine at the Lady Hardinge Medical College, New Delhi, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115-761. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:10 p.m. onwards. During the ongoing fight against the COVID-19 outbreak, banks are at the forefront in providing the necessary support to people. Doordarshan News correspondent spoke to SBI chairperson Rajneesh Kumar on steps taken by the banking sector to provide essential services.
कस्टमर्स की सुरक्षा और कर्मचारियों के परिवारजनों की सुरक्षा, ये हमारी टॉप प्रायोरिटी है। और इसके लिए जैसे ही जब ये कोरोना वायरस के लिए लॉकडाउन की बात आई थी, उसी समय हमने एक एसओपी बना के अपनी सारी शाखाओं में दे दिया था। ये हमें मालूम था कि एक एसेंशियल सर्विस है, वो शाखाओं में हमें जो एसेंशियल सर्विस है वो प्रोवाइड करनी होगी। शाखाओं में ऐसी व्यवस्था जिसमें कि कस्टमर्स के बीच में एक आवश्यक दूरी बनी रहे, तो इसके दिशा निर्देश हम लोगों ने दिए। और आईबीए जो इंडियन बैंक्स एसोसिएशन है, उसने भी सभी बैंकों को इस बारे में एक एसओपी बना के दिया कि हमें इन परिस्थितियों में किस तरह से काम करना है, जिससे कि बैंकिंग व्यवस्था सुचारू रूप से चलती रहे।
In an effort to guard against fake news being circulated on various platforms, we bring you a new segment on fact-checking and myth-busters. There is a misconception that holding breath for 10 seconds or more without coughing or feeling discomfort means a person is free from coronavirus. In a tweet, the Press Information Bureau said, being able to do so does not mean that a person is free from the coronavirus. It rejected another claim that exposure to high temperatures prevents COVID-19. There is no scientific evidence to prove that coronavirus can be prevented in high temperature. Countries with hot weather have also reported COVID-19 cases.
In news just in, the number of COVID-19 cases in the country has climbed to 8,356, while the death toll rose to 273. As many as 715 people have been cured or discharged, and one had migrated. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Man Ki Baat program on All India Radio on 26th of this month. It will be the 64th episode of the monthly radio program. In a tweet, Mr. Modi invited people to share their ideas on topics he should address in the 64th episode of Man Ki Baat. The convicted killer of Bangladesh's first president, Sheikh Mujibur Rahman, was hanged immediately after midnight last night in Dhaka. The self-confessed fugitive and former army personnel, Abdul Majid, was arrested on 7th of April from Mirpur area of Dhaka. Easter is being celebrated across the globe today. It signifies the resurrection of Jesus Christ after his crucifixion and death at Calvary on Good Friday. President, Vice President and Prime Minister have greeted people on Easter. President Ramnath Kovind said, a very sacred festival for the Christians, Easter inspires people to follow the path of love, sacrifice and forgiveness. Vice President M. Venkaiah Naidu said, the story of resurrection is a reminder that light will always triumph over darkness. In a tweet, Prime Minister Narendra Modi said that people remember the noble thoughts of Lord Christ, especially his unwavering commitment to empowering the poor and the needy. He expressed hope that this Easter will give people the added strength to successfully overcome COVID-19 and create a healthier planet. And now, before we end the bulletin, here are the headlines once again. Maharashtra, Telangana and West Bengal announce extension of lockdown till 30th of April. Agriculture Minister Narendra Singh Tomar assures that there will be no shortage of food grains in the country. Srinagar-Leh highway reopens to maintain the supply of essential commodities. Consignment of hydroxychloroquine from India arrives in the United States. and Easter celebrations across the world amid COVID-19 pandemic. President, Vice President and Prime Minister greet people on the occasion. And for details of these stories and more, you can log on to our website www.newsonair.com and the News on AIR app. And with that, we end the Midday News.